Fat. Ugh. For many of us, the word by itself is enough to conjure up feelings of insecurity. But what if doctors could take your unwanted fat and put it to good use? A few forward-thinking plastic surgeons in North America have done just that, pioneering new techniques allowing fat from our problem areas to be transferred to other parts of our body, helping to turn back the hands of time. For more on this subject, here is Dr. Andrew Wolin.
My name is Dr. Andrew Wolin, and I am double board certified. I am certified in plastic and reconstructive surgery, as well as certified in head and neck surgery. And I am a caring doctor. Patients come to me complaining that they want to look younger, they look older, and they try to figure out what it is that's actually making them older. And usually the concept of aging is a little bit more complex than you would appear to be. Part of the issue is the loss in volume of the face. So they come complaining that they're looking older and more gaunt, and the issue is how to re-inflate the face, how to add volume to the face. Second issue they come in with is, and part of it is secondary to the loss in volume, is the hanging, the ptotic, the old look because things are just sagging. Part of it is because they've lost the volume, and part of it is because they've lost the natural integrity of the skin, and it kind of hangs down. And the third issue that they deal with is mostly a surface issue, either a textural issue or an issue with just the skin just doesn't look as bright. And so I try to find what we can do to address those three issues. The first issue of loss in volume, I think, has been beautifully addressed by adding the patient's own volume source to the face. And what I do is I utilize body fat, and I take fat from areas that are not diet dependent. There's different types of fat in the body depending on the location. Some areas are called repository fat, where the fat is stored fat that's ultimately used for metabolism, for the nutrition portion of it. But there's a lot of fat also that's more structural fat. It's fat that's in the thighs that doesn't respond really negatively to a loss in weight. You don't really see the thighs disappearing on you when you lose the weight, as you can see in the abdomen, as you can see in the flanks as you lose your weight. So I try to target the areas that I will utilize that will not change very much with differences in weight gain and weight loss. So when I harvest fat to put in the face, I look at areas of the body that won't be negatively affected by weight loss or weight gain. So we have stability in the facial sculpting process. So the fat that's taken from, say, the thigh areas, which doesn't really change very much with weight gain and weight loss, that fat gets to live in your face. It doesn't realize that it's still not in your thigh. So it doesn't respond to the same dietary issues, and it maintains its form and its full for a much greater amount of time, as opposed to taking fat from areas that will change very much with weight gain and weight loss, such as the abdomen and the flank area. So by taking fat from areas that you hate, areas that don't respond to exercise, areas that don't respond to diet, by taking that fat from those negative areas and putting it in your face, you basically now have the ability to use material that has longevity, that has stability, that can conquer a lot of facial aging and asymmetry problems in a much more permanent biological way.
I heard of fat transfer before, and what I liked about it was that we were going to use my fat. And so the odds of something being rejected, or that my body rejecting some sort of filler, you know, wasn't there. And so I liked that. It was more natural. It was me. Well, let's put it this way: I haven't lost anything. You know, when we filled the areas that we filled, it hasn't declined in volume. It's become very soft. The color is good. The texture is good. I don't understand why that happens. I don't understand. It's almost as if something is growing, or it's reproducing, or it's. I don't know how to put my finger on that. I really don't. I don't get it.
So when patients come in and tell me that the skin has a better look to it, it has a better glow, it has a better tone, we hypothesize that we're transferring more than fat. We are transferring primitive adult stem cells with our transfer, and this is included in our fat package that is doing all of these good things. We don't have the absolute science to prove it at this point, but we have enough feedback from our thousands of patients that we know we're doing something good.
And I'm almost 60 years old. Can you believe it? But I know that I look great, I feel great. I used to feel like I was, I was in my mid-50s. I felt tired, I looked tired. No woman should have to go through feeling that tired and drawn. I'm happy.
Fat transfer procedures are a wonderful option for both men and women seeking facial rejuvenation in a more natural way. Here's more.
So about 20 years ago, we came up with a system where we could take a syringe and we could put it on a small little cannula here, and then with this syringe and cannula we could make a little poke in the patient's either the thigh or the area that we were taking it from, usually it's the thigh, and then put the cannula right under the skin. Now this had to be done under either a local anesthetic or you had to add a lot more local material and some sedation. Usually it's done just under local. So we can local up an area, make a little poke, put this under the skin, and then by pulling on the syringe I can suction out little bits of fat through here and put it into this syringe. Now once the fat is taken out into the syringe, I take this fat and put it into my centrifuge and centrifuge off the water and the oil that is in the preparation. The water is really the local anesthetic and the oil is the damaged cells that we create by pulling out the fat. And once that's done, when it's completed, I then take the fat that's been centrifuged out and it's sitting in this syringe in layers. We get rid of the oil and get rid of the water, and then we take it and put it into smaller syringes and then put these cannulas on and then inject the fat into the face using these different cannulas. Most of the cannulas used are very fine that are used to inject into the face. So the fat is then re-injected into areas of the face. Now what we found out is for small volumes of fat this works fine, but if you need a lot of fat to put in the face, we kind of go to a different model, and the different model is a very interesting device, be it disposable or similar to the cannula that I just used, and I do the same procedure. I numb up an area on the leg and we make a poke, and then I hook this up to my suction machine, my suction device here, and turn this on, and the suction device then will suction out the fat in a very low negative pressure. I can control that, and the fat will then accumulate in this chamber, and the chamber is a fantastic little screen filtered chamber that keeps the fat in and filters out any oil and filters out any water. And we found that this produces less oil, which means we're not damaging as many of the cells as we do with the smaller device. And this works very nicely. And then once the fat is taken from here, then we do the same type of thing where we take it and we inject it into small syringes that we are going to then inject into the face. I do not centrifuge the fat when I use this device, so it saves a step and it's a little bit quicker in terms of doing that. When I need a very, very large volume of fat, I don't use either of these devices. I use a device called the Aquavage, and the Aquavage device is a large canister type device similar to this device here, but it has a special filter in it. And we suction out the fat from multiple areas, because this is usually when we need to put fat in the breasts or put fat in the buttocks, we need a lot more volume. Just in giving you an example, most faces take 10 to 20 cc's of fat in each side of the face. When you're doing a breast, even just to increase the breast volume 1 cup size, you need approximately 250 cc's of fat for each side. So it's a significant amount more fat, and it needs to be taken out in a very gentle way where we don't damage any of the fat. So the fat then is taken out and put in the Aquavage canister, and then it's filtered automatically, and there's an opening at the bottom, and then we pull the filtered fat out of the bottom, and we do the same thing, and we put it in small syringes, and then we inject it throughout the breast, or we inject it in the buttock. Either way, each area has different tools that are used to get the best result for the areas that we want, and getting the fat out of the areas that in the most gentle way, and then having the greatest survival of the fat in where we're putting it.